The South African National Blood Services has made a call for blood donations to mark World Blood Donor Day on June the 14th. And World Blood Donor Day is a global event that was established by the World Health Organization in order to raise awareness about the need for safe blood. According to the South African National Blood Services, less than 1% of South Africans are active blood donors. And this year, the World Blood Donor Day slogan is 20 years of celebrating giving. Thank you, blood donors. And to further unpack the importance of World Blood Donor Day, I am now joined in studio by Dr. Deborah Vaz-Van Der Riet, who's a hematopathologist. Doctor, I hope I said that correctly. A very good morning to you. Thank you so much for joining us.
Thanks. It's a pleasure to be here. You did indeed.
Thank you so much. So, Doctor, what is happening? What is hematopathology, and what does your job really entail? I know what hematologists do, but what in this case is your job?
So I'm just a branch of hematology. I'm a pathologist. I work mainly in the lab. But I do everything a hematologist does. Besides, I don't see patients that often, but I still have my patients that I see on occasion. It's Steve Pico, hematology patients. I know, everything about hematology, everything about blood donation. That's my passion.
Let's talk about what is currently causing the shortages in terms of those blood donors and the blood numbers, the blood levels that you have currently in the bank.
I think people are reluctant. They're reluctant to donate. I think there's a lot of misconceptions.
What is causing this reluctance, doctor?
The easiest would be patients or people are scared of needles. That's a big one. People feel they're not healthy enough to donate. So a lot of people feel that they're not, good enough to vote. Their blood's not healthy enough. But also, like I said, errors of misconception. I think there's been a lot of errors from past mistakes and things that make people scared of donating or feeling like they shouldn't.
Who can donate blood, doctor? I'm sure you get this question all the time, even though a lot of people know about, the process of blood donation. But who is healthy enough to actually donate blood? Is it based upon gender, upon race, upon age, upon weight, all those things? We're just doing a quick eye test with the guys in studio, and we thought they all qualified, but subject to further tests, of course.
So anyone from the age of 16 to 75 is eligible to donate. You need to be otherwise healthy, no acute or chronic infections, no serious medical issues. So anything that would affect your hemoglobin level or your iron. And basically, you shouldn't have any sort of risky behavior. So you need to stay away from risky behavior, such as multiple sexual partners, IV drug users, so things like that. And then, yes, they do obviously do a test to see that you are okay. They'll do your hemoglobin level, they'll check your iron, they'll check your blood pressure. So see it as a mini clinic visit as well, so going to donate blood. And if everything is within check, then you're great, you're good to go.
I mean, you spoke about 16-year-olds, right? One would presume that you actually need like parental guidance or permission in order to actually go and donate. Is this the case? Because I know we started donating blood back in high school, and it wasn't necessarily the parents. It was up to us whether or not we wanted to donate.
Yeah, it is. I think at 16, there's a lot of important decisions you already can make. And donating blood is one of them. You have the ability to save a life, or actually save 3. So why not? And at 16, you're capable of making that decision, as long as you are within the weight criteria. You mentioned that. So you've got to be about 50 kgs.
Doctor, I mean, there's this question. I know you mentioned a lot of people having that reluctance in terms of donating. So a lot of people want to know, are those people that actually receive COVID-19 vaccines actually still able to donate blood?
Yes, absolutely. There's no reason why, if you've had any sort of vaccination, you should not be able to donate. Like I said, as long as you don't have any serious medical condition, cancer or heart condition, then you are good. to donate.
And then let's talk about the process that the blood is actually taken through, that is undertaken, doctor, to actually ensure that it's safe for somebody to receive blood. I know it goes through rigorous tests to ensure that by the time that the recipient is actually receiving the blood, I mean, it's gone through all the checks and balances. But there are some of those times when that 1% will sneak in and you'll hear that somehow unsafe blood actually got into a patient, but it's not a common case.
No, it's not common at all. And we've really come a long way. The blood bank has come a very long way. Besides the checks that they do in the beginning with the questionnaire that they ask the people that are donating, just to make sure they're not in risky behavior or that they don't have any sort of contact with any infections. After that, they do go through the rigorous testing of HIV, hepatitis, all those things to make sure that the blood is safe. And the window period for the testing has actually been reduced. So what was a lot, longer that they couldn't pick up certain infections, now they can pick them up much sooner. So it's advanced, and the chances of actually, as you said, contracting something from blood is a rare occurrence. Very rare.
And then what about some of those undetectable types of infections or diseases, doctor? Are these are you then able to, I mean, you've just said that there's now a shorter time where you actually check the blood and actually get it through to the donation phase, but I mean, isn't this then leaving room for some mistakes to happen in that you've cut the time where you're actually preparing and screening the blood for donation?
I think that we all need to understand that there is always going to be room for the possibility that it could happen. In medicine, we always say never say never.
Oh yes, and you do sign an indemnity form actually before you receive blood. That's one thing that we actually need to talk about.
So definitely there are risks involved, and hence why we say that the procedure for donating blood is so rigorous, because we want to make sure that that blood is safe at all costs. But yes, anything can sneak through. We do obviously try and prevent that based on the questionnaire. If patients have travelled to a certain area where we know there's a specific infection that's more common there, then we might defer the patient from donating for a couple of months. So yeah, all those things are done to check as closely as possible that we have not missed anything. And I think the blood bank does a good job. They manage to catch majority.
And then, I mean, let's talk about the importance of donating blood. What are some of the benefits? A lot of people will say, but I've been donating blood since I was in high school, but when I got injured and I needed to get blood, I then had to pay an exorbitant amount. And we know a pint of blood is extremely expensive, doctor. So why can't blood donors actually have access to some of the blood, especially if they've been donating for, let's say, since high school?
So donating blood is truly a selfless act. And I think that people need to understand that in order to make the blood safe,
donor.
Absolutely, bone marrow donor. It is a completely selfless act. And if you're going to go through that process, you need to understand that there are costs involved with making sure that the blood is safe. So if everyone who donates does not pay for blood when they, for example, go to a hospital setting, it's going to now take back on the costs available to make that blood safe. So we have to realistically understand that, we do need the funds to make things work. And that's why. But donating blood, it really is, like I said, a selfless act, and you should want to do it to save lives. You should want to, obviously there's benefits to it. Like I said, there's health checks that you go, it helps you, give you a sense of, you look into your life and you start seeing, okay, have I actually gone into any risky behavior? So it helps you self-reflect as well. But also there are health benefits to donating as well. There's the benefit of decreased heart disease. So patients, especially with very viscous blood or very thick blood, they have benefits in donating regularly.
Now we understand there's other specimens, doctor, that they actually draw from the blood, either than the blood itself, something like your platelets. Can you understand how that process is actually conducted as well?
Yes. So that's why we say that if you donate 1 unit of blood, you're actually able to save 3. And that's because we split the blood, also the blood bank splits the blood into 3 components. It's your red cells, the oxygen-giving cells, your platelets, which arrest bleeding, and also with plasma. And plasma has got many proteins, antibodies, necessary things, coagulation factors as well to arrest bleeding. So it's very, very, very rich in many things that people need.
Absolutely. And you never know until you actually need those platelets.
Absolutely.
And then that's when you're going to understand that sacrifice, that human sacrifice, personal sacrifice that is made by people. So, Doctor, in closing, it is World Blood Donor Day, which is a global event. So what is your message there? And also maybe just appeal to the more than 1% of South Africans that are not active blood donors. I mean, less than 1% are actually active.
Yeah, it's scary.
It's scary.
It is scary. I'd say try and get rid of your fear and, look into yourself as a human being and wanting to save someone else. Because
People
I know
want
everybody has
results, Doctor.
Yeah, I know that's always the reason. But I think that if we look deep in ourselves, we all are very loving and very giving.
Charitable, yeah.
Every time if we see someone on the side of the road, if they need, help, we as human beings always run to their aid. So I feel like there is a part of us that wants to help, and we just need to reach into that and,
Any specific blood drives that you're going to be conducting during this period? Where can people go, even some of the studio crew when they go on break?
So there's many blood donor centers, and you can find that on the SANBIS website. But blood drives, you'll just have to see what is coming to you at that time.
It doesn't take long, does it, Doctor?
It doesn't. No. If you are there and you are available, you could donate a unit. I've seen it done in 15 minutes. So obviously the preparation, the questionnaire might take a little bit, but all in all, I think about a 30-minute 45-minute.
All right. So, Doctor, we wish you the best of luck. Thank you so much for joining us this morning. That was Dr. Deborah Vaz-Van Der Riet, who is a hematopathologist, talking to us about the importance of donating blood as, of course, we observe World Blood Donor Day, which is a global event.